Welcome to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. The district is the place to keep you updated, informed, and inspired regarding everything Fulton County District 4. Immediately following this short break, we will have an exciting conversation with Dr. Donnell Collins of Centerwell. Don't go anywhere. We will be right back. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. Joining us today is Dr. Donnell Collins. Dr. Donnell David Collins II is a board-certified, fellowship-trained primary care physician. He is the physician lead for Centerwell Senior Primary Care in Georgia. Dr. Collins completed his fellowship in geriatrics and gerontology at Emory University School of Medicine. He earned his MD from Morehouse School of Medicine and completed family medicine residency training at Wellstar Atlanta Medical Center. Dr. Collins graduated with a Bachelor of Science in Biomedical Sciences from Oakwood University in his hometown of Huntsville, Alabama. Dr. Collins is a recipient of numerous awards. Most recently, he has been recognized as a 2023 Centerwell Senior Primary Care Star Award and 2022 WellBe Survivor Award. Dr. Collins was a community medical doctor at WellBe Senior Medical, which provides value-based concierge primary care for seniors in their homes. Dr. Collins previously worked as a staff physician before becoming regional medical director at Peachtree Immediate Care, an urgent care company. Dr. Collins chose medicine to help people live longer, healthier lives. In his free time, he enjoys being with his family, camping, reading, and sports. Dr. Collins, again, thank you for joining us on the district. How are you?
I'm doing very well, Commissioner Hall. I want to thank you for that warm welcome and introduction. Thank you for having me. It's good to be here.
Thank you for being on the show. Can you tell us what is Centerwell Senior Primary Care?
I'd love to. Centerwell is a senior-focused primary care center designed for patients 65 and up. Each location has its own care team and includes a doctor, a nurse practitioner, and medical assistants. Patients have access to a nurse care coach, a behavioral health specialist, a clinical pharmacist, social workers, and referral specialists as well.
So, what makes Centerwell Senior Primary Care different from other medical offices?
Oh, I would be happy to admit that it's multiple things. For sure, it's going to be our people and our passion and commitment to our cause. But I think really one of the primary drivers that separates us is our care model. Our physicians and care team focus on the whole patient and all that impacts their health, physical, emotional, and social. We take pride in the fact that we offer longer appointment times, up to 50% longer than the typical doctor's office. We've got several things in the clinic as well with seniors in mind, whether that be our scales that can weigh them if they happen to be in a wheelchair, or exam tables that easily convert to up and down so we can access and facilitate the exam better. We offer a choice in Atlanta, looking at our care model that covers healthcare in the center, also healthcare in the home, and also we have virtual options available too. Our primary care centers include attached activity centers, which I get really excited about because this is an opportunity for our seniors to come together with other patients and other members of the community. It's really important to note that these centers are available to the entire community. So our patients will bring their spouse often, or a coworker, or a friend to come, and we get a lot done in these spaces. And so these are just a few of the things that really separate us, I think, from our peers in this space, and gets me really excited to talk about.
It sounds like it's an amazing way, an amazing approach to caring for seniors. What is different about caring for seniors and why do they require a unique approach?
That's a great question. Seniors often have multiple chronic conditions, potentially more complex health issues than younger patients. And as a result of that, we really have to be very deliberate. And like I mentioned before, we have to take extra time with these patients. So that's why we have the 40-minute appointment blocks that are available. I get excited every day because every day there's at least one patient who will make a comment on, my goodness, Dr. Collins, and it's not just me, it's other providers, but you got to sit down and talk to me during this visit. And I really think that's an important component of senior care, geriatric care. We'll invite family members also to be a part of those visits when that's appropriate. So, and the final thing I'll mention is care coordination is really, really important for seniors too. I touched on the fact that there's a medical complexity. And so sometimes we're trying to coordinate resources in the community, or we're trying to coordinate care with a specialist. We had to have a procedure done. And those things are really, really important. And I'd say we do a good job of coordinating those things, and giving our best to our patients in that way.
Well, how many locations in Metro Atlanta are there and where exactly are they located?
Yeah, we're scattered in and around Metro Atlanta. We've got a total of 7 clinics that are open, and they are located in various neighborhoods. I'll list them for you: Grove Park, Adamsville, Greenbrier, which is where I work, College Park, Morrow, Decatur, and Stone Mountain. You can also go and visit our website at centralwellprimarycare.com to find the location nearest you.
Well, your Grove Park Center opened late last summer in a building that you transformed. Would you tell us what you were able to do there and why you wanted to be in that area?
Thank you for the question. Yes, our Grove Park Center is really near and dear to my heart. It has a unique story because it was in an area that really, in many ways, been forgotten. It was in a building that had been abandoned, and there was homelessness in the area, and really had become a blight in the community. And so we identified this area primarily because it's actually a primary care desert. Oftentimes we talk about food deserts, where some individuals have difficulty accessing healthy food and produce in a short distance of their home. We actually are identifying primary care deserts, where there's large swaths of real estate territory where there's no primary care providers. And so that's another reason why we targeted that community. And we really believe that that community really deserves a state-of-the-art facility, a place that they can be proud of, that they can bring their friends to, and really share and celebrate as they maintain their health, and find more health.
Wow, I have never heard of a primary care desert. That is an amazing statement, and it's awesome because it made me think about food deserts and the digital divide and how
Yes.
there are many neighborhoods that just don't have the things that they need to have a great quality of life. And this is just adding to that list, showing us that there's another need that needed to be met. And Centerwell has really taken a hold of this and done a great job with addressing that need. I love this.
Absolutely. I'm excited too. I share your enthusiasm. All 7 of our locations are actually in areas that we would classify as primary care deserts. So that's part of our selection criteria when we look to go into those communities that have the most need, and patients that are most vulnerable.
Well, Dr. Collins, thank you for taking the time with us to share such important information about Centerwell and the impactful work the primary care provider is doing for our seniors. Let's take a quick break, and when we return, we will continue our discussion on Centerwell with Dr. Donnell Collins. Welcome back to the district. I'm your Fulton County Commissioner of District 4, Natalie Hall. If you're just joining us, we're having a robust conversation about Centerwell. We previously discussed the background of Centerwell and what makes this primary care provider different from others. I'm back with Dr. Donnell Collins. Dr. Collins, welcome back to the district.
Thank you for having me and continuing the conversation.
You know, Centerwell's health equity initiatives are a part of what makes it different. You work to help the whole community, not just the patients. So, could you explain what health equity means and what Centerwell does for the community as it relates to health equity?
Absolutely. Health equity to me simply comes down to access and education, sharing information. There's lots of things that can inhibit that, whether it be education or social resources or maybe just misunderstandings that people might have. But navigating those things and making sure that everyone has an equal footing when it comes to maintaining and pursuing their health is really a key component of health equity. So, as I touched on just before the break, the importance of putting these clinics in places where they're really, really needed. This is leveling the playing field, giving persons who didn't previously have access more access. The other thing that's really, really important is improving quality of care. We know that there are gaps. Doctors don't always make the right decisions and don't always have the resources that they need, and we sometimes get outcomes that we don't desire. But we know that if we put together a good team and we train them well, and we're constantly thirsting after knowledge and educating ourselves, that we're in a position to really improve the quality of care. And I think that what really separates us is not so much the fact that we have really, really good providers, which we do. It's really that interdisciplinary approach because two is always better than one when it comes to trying to solve really complicated and challenging situations. So, addressing those non medical barriers to healthy living, such as the social, the behavioral, and the economic determinants of health, are really important. And Centerwell is well positioned with the interdisciplinary approach that we have to really level the playing field and improve social and educational opportunities in our activity centers, which I mentioned before. And then also, we can help coordinate and arrange for housing and transportation resources as well.
Well, you mentioned food insecurity and transportation are barriers to healthy living. How have your centers helped patients access healthy food and overcome transportation challenges to get to their appointments?
We do a really good job of leveraging benefits in the patient's plan that will facilitate transportation. And if there's gaps where their own benefits might not cover, we actually will, under certain circumstances with mild limitations, provide transportation ourselves to the primary care clinic itself for primary care visits. That's been something that's been really effective and resonated with patients because many of our patients either don't live on a bus line or they don't have access to a reliable vehicle. And so that is a major component. Also, we have community partners like the local American Health Association and the Metro Atlanta Coalition for Healthy Neighborhoods to offer blood pressure checks, education classes, healthy food options. And these are efforts that we're doing in the entire community. Centers are often conveniently located around bus routes, anticipating some people might have some challenges. Um, and yeah, thank you.
Well, thank you. And earlier you mentioned in-home primary care. Can you tell me a little bit more about that option for seniors?
Yes, this is a space I'm very comfortable talking in. You briefly touched on some of my work experience in the past, and I actually worked in primary care for seniors in the home. So, with Centerwell, we have two divisions. We have a primary care anyway division, which is the home base where they'll take primary care into patients' homes, and then we have the primary care organization, which are the brick and mortar clinics, which I've just described those 7 clinics. Um, in the home-based space, you can still expect world-class care. What we're finding when we get feedback from patients is that increasingly patients, when given the option to say, hey, listen, you can get if you're not sacrificing any quality of care with your visit, you can still get your labs. We can still arrange for x-rays. We can still coordinate specialists and resources, but we'll bring that care into your home. We're finding that many patients actually prefer the in-home option. And so we really want to be in a position to meet those needs as well. There are also some patients who are homebound. They have a great difficulty getting out of the home. So our primary care anywhere efforts brings primary care for seniors actually into their homes. This is completely covered by eligible insurance plans, just like it would be in the clinic. And our patients really enjoy that convenience and getting really good care at their home.
I love that because it makes me think back to when I used to visit my great grandparents in Arkansas, and we would watch these old movies, and they had the doctor going to visit the person at their home, and he had the old doctor's bag and everything.
Yes,
It reminds me of that, and I always wonder why we had moved away from that because it is very much needed. You know, there are a lot of seniors who are they're just tied to their homes, and they really need for the services to come to them. And I really believe in that. I believe in taking the services directly to the people where they live, work, and play. So I love this about Centerwell. And so, speaking of care, what insurance plans does Centerwell accept? And do you accept Medicaid? Because that is a big question that seniors always have.
absolutely. We don't accept Medicaid alone, but we do accept people who have dual eligible for Medicaid and Medicare. So that would include Medicare, original Medicare plus Medicare supplement and Medicare Advantage plans, such as Aetna, Anthem, Blue Cross Blue Shield, Cigna, Humana, WellCare, United Healthcare, Sonder, the list goes on and on.
And so, what if a senior has one and doesn't have the other, and maybe they don't know how to get Medicaid and Medicare? And is there help for them?
Absolutely. We have market representatives that they go as agents that will help patients navigate even before they become signed up, help them navigate what are they eligible for? Are they getting the most out of their plan? Oftentimes, the agents will be in the clinic and will talk with the patient about, hey, I see you have this outstanding benefit. If you go to the pharmacy, you have $100 credit. You can buy a blood pressure cuff and things of this sort. So yeah, that's just a couple of the efforts that we're making in that regard. But it's a good point, and we do try to address it as it comes up because that's one of the main things. Also, you can call any clinic and you ask, hey, am I eligible? We'll put you in touch with the person to let you know, hey, yeah, you're eligible, and let's get you enrolled because it is very difficult to navigate and can be quite confusing.
That is awesome because that's one of the things that I always see is that our seniors need someone to hold their hand through the process and just help walk them through it. And so that's a great service that Centerwell offers. And do you plan on growing Centerwell senior primary care locally or across the country?
Absolutely. We believe what we have is really going to be very valuable to patients to help them attain their health, maintain their health. All of our centers in the Metro Atlanta area are currently accepting new patients. We want to grow our patient numbers and help more seniors access quality health care that we offer. The primary care anywhere division that comes into the home is also accepting new patients. They see patients as well as in the Atlanta area. They have a footprint in Savannah and Columbus as well. So if you have a family member in those communities, don't hesitate to think about us in that regard. Across the country, we're operating in 15 states, and Centerwell has plans to continue to expand the number of centers over the next couple of years. I'm excited to be a part of that growth.
Well, Dr. Collins, I appreciate you coming on the district to share this information about Centerwell and all the great services and programs that you offer. Everyone who knows me knows that I am very big on providing services and programs in Fulton County has the best senior services in the state of Georgia. And so it is really great to find out that we have a medical center in Centerwell who is really trying to offer what our seniors need to stay healthy. So thank you for providing this medical service and making it accessible to our seniors and being on the show.
Thank you. I want to thank you for your commitment to your constituents. I know you're very active in the community, and I know the seniors are very near and dear to your heart. Even just you prioritizing this conversation and making time for us to talk is really appreciated. So thank you for your commitment to Fulton County and Atlanta and seniors in your community.
Thank you, Dr. Collins. And when we return, I will share my closing thoughts. Fulton County government will continue to keep you updated via our website at fultoncountygA.gov. And please follow me on Facebook, Instagram, and Twitter at FulcoD4, FULCOD, and the number 4. That's our show for today. I'm your Fulton County Commissioner of District 4, Natalie Hall, and thank you for watching the district.